If you're suffering with uterine fibroids, you may be wondering, can I have children? Women have two main options that are suffering with fibroids and they're interested in fertility. They can either undergo surgical myomectomy. Surgical myomectomy is a surgical procedure that is done under general anesthesia. It's done in the hospital. The patients will likely stay in the hospital for a couple of days and then have a 6 to 8 week recovery at home. One of the biggest drawbacks for surgical myomectomy is that it doesn't remove all of the fibroids surgically in the typical usual case. Therefore, there will be fibroids left behind in the woman's uterus when she wakes up from this major surgery. Also, myomectomy patients have to sign a release saying they understand if they get into too much bleeding surgically or they physically can't close the uterus back together, which happens relatively often, a woman might wake up without her uterus. So every woman has to be prepared for the fact that they go in for surgical myomectomy and end up with a hysterectomy. Contrast that with the uterine fibroid embolization procedure. This procedure is done by an interventional radiologist like myself. It is performed completely as an outpatient. There is no hospital involved at all. The procedure is very quick. In my hands, the procedure takes about 30 to 45 minutes. The patient recovers for about 4 or 5 hours and then is discharged home with just a Band-Aid at the entry site in the body where we went in, either at the top of the right leg or at the left wrist. At home, the recovery is about 5 to 7 days versus 2 months or more with surgery. After you see me in the 3-month follow-up visit, you can start trying to have a child again. It's really, really important to check at that 3-month visit to make sure that all of the fibroids are dead, and typically that is the case. So if the fibroids are all dead and your symptoms are significantly better or disappear entirely, you can then try to have a child.